Hi, I'm Max from Jones Real Estate. Dental health is very important in our daily life. I usually go to dental cleaning twice a year prior to COVID. However, I haven't been to any dental clinic since the COVID outbreaks, as our hygiene understanding that a clinic could be easy to get infectious of virus. But is a worry really necessary? What's a sensible way towards our dental health during the pandemic? Today, we are here going to face-to-face with a local dental clinic about smiles in Chatswood. Let's hear from the expert. Hello, Dr. Ma. Thanks for taking the time with us to answer our questions for our fans.
No problems.
Okay, how long has About Smiles been running in Chatswood? And I noticed that the clinic is very, very big. And what service do you cover?
So About Smiles started with care dentistry about 8 years ago, and we're one of the largest centers in Chatswood. We have about 8 treatment rooms, okay, and one of them is a fully equipped surgical theatre. Okay, we have about 7 dentists, 2 hygienists, and 3 dental specialists working here. So we provide service that covers all facets of dentistry, starting from check and clean. We do composite restorations, we do root canal treatment, periodontal treatment, we do single implants, 3-4 unit bridges, and we also cover a lot of Invisalign cases. Okay, so that's all the general service that we provide.
Right.
In terms of specialist service, we have a specialist that does a lot of full arch rehabilitation and full arch implants. If you say a patient lost all of their teeth, they can come in and they'll walk out with full mouth of teeth in a prosthetic version of it. Okay, and then also we have a periodontal specialist that looks after moderate and severe gum disease. We also have a pediatric specialist here.
So they cover everything?
Pretty much everything.
Okay. Dr. Ma, how often do people really need to check their dental health, and how often do we need to do the cleaning, general cleaning?
Okay, so that's a good question. A lot of patients ask me this question, and in terms of someone who's looking after their teeth quite well, they usually need to come to us once every 6 months. Okay? Because that's the amount of time that it takes for a certain amount of tartar and plaque to build up to a significant amount, and then we really need to clean them off to maintain a good periodontal health and your gum health. And the other thing is small bits of decay can happen during that period of time, and sometimes you might not notice any symptoms, but as dental professionals we'll be able to use x-rays and all our technology to detect those decay and treat it as early as possible.
Thank you. Okay, Dr. Ma, during COVID pandemic, people are concerning they could be easy to get infectious of virus in the dental clinic.
Yes.
That's the concern. What is your response to those concerns? And is there any additional procedures in place in the clinics that people do not have to worry at all?
Okay, that's a good question. So during a pandemic, obviously there's a lot of concern from the local community because we do procedures that's prone to exposing everyone, spraying a lot of aerosols and everything. So there are a number of things that we added on top of our excellent sterilization procedures, and one of them is the extra barriers. Okay, so we add some extra barriers. We wear face shields where it's needed, so full, instead of just a mask, a full face shield.
Right.
And also our sterilization process is that we use a barcode system to scan into the patient's files each and every instrument that they used, so we can trace things back if anything happens. Right. And that's our current standard. We also have a very spacious waiting area to comply with the government's social distancing requirements.
I think that's pretty safe, pretty worry-free for those patients.
I think so.
Thank you. Dr. Ma, last but not least, which private insurance you guys accept here, and what do they usually cover?
Okay, so in terms of private insurance, the amount of coverage we accept basically every single private insurance.
Yep.
Yeah, okay. The amount of that coverage is really dependent on your level of cover. Okay.
Right. Yep.
But in general,
Yep.
there are two categories. One is called general dental, which covers things like check and cleans, simple fillings, simple extractions, and a few other things like x-rays and stuff like that. Okay. And the amount of coverage is usually, I would say, 50 to 70%, somewhere between there.
Right.
And the other category is when you have other problems with your mouth, slightly bigger problems, things like gum disease, things like teeth that needing nerve treatment, which is like root canal treatment, and those belong to what's called major dental, and the amount of coverage is usually a bit less. Okay, so let's say between 30 to 50%,
right.
But they are much more costly treatment. Things like also including things like crowns and bridges and implant treatment as well.
Right. Thank you.
Okay.
Thank you, Dr. Ma.
Thank you, Max, for this invitation. One last thing to mention, About Smiles has just opened a new branch in Crow's Nest just last month. So I'll be seeing new patients over there as well as remaining in Chatswood as well.
Oh, that's wonderful. Thank you very much for your time today. I hope Dr. Ma has clarified all the concerns and questions you guys have. For any dental inquiry, please reach Dr. Ma in About Smile Chatswood and About Smile Crow's Nest. The contact details will be below the screen. Thank you very much.